And I call the member for shortly.
Thank you, Mr Deputy Speaker. Throughout the COVID-19 pandemic, communities right across our nation have turned to government, the public sector, for essential services, support and expert health guidance. The pandemic has proven once again what Labor has always known. A fair and just society needs a strong and effective public sector. The success of the Australian people at managing this unprecedented health crisis, in which they put the well-being of their fellow citizens first, has been supported every step of the way by public institutions and hard-working public servants across every jurisdiction. However, the COVID pandemic has also brought into stark relief the Liberal National Government's flawed and failed approach to managing our federal public sector and its workforce over the past 8 years. The regrettable reality is that since coming to office in 2013, the Liberal National Government, irrespective of who has been the Prime Minister, or in fact the Deputy Prime Minister, has been steadfastly engaged in the privatisation by stealth of the Commonwealth Public Service. Their record speaks for itself. They cut more than 12,000 federal public service jobs before the pandemic hit, while simultaneously increasing wasteful spending on expensive consultants, contractors and labour hire firms to do work previously performed more cost-effectively by public servants. This is a direct result of the Liberal National Government's ideological-driven approach to the public service, which has been exemplified by its commitment to an arbitrary and damaging staffing cap. It is this policy that has made it effectively impossible since 2013 for key service delivery agencies such as the Department of Veterans Affairs and Service Australia to directly employ APS workers they have needed to deliver the quality services Australians deserve. But because the cap does not apply to outsourced labour, where agencies have needed more workers, they've been forced by the government's myopic policies to engage private labour hire firms, contractors and multinational consulting firms, even though it's been proven time and again that it's demonstrably cheaper and more effective to build up in-house capability within the public service. You need to look no further for the impacts of this policy than the Department of Veterans Affairs, which last year confirmed that 42% of its workforce, including more than 50% of its claims processing staff, were being sourced through labour hire companies. 50%, Mr Deputy Speaker. This over-reliance on labour hire has delayed and disrupted critical services to our veterans due to staff turnover and the loss of expertise and experience when temporary employees leave. It's also coming at a considerable cost to Australian taxpayers, with evidence to Senate estimates in March that the DVA has entered into more than $141 million in labour hire contracts in the 6 months to 31 December 2020 alone. And we know from multiple agencies that the cost of labour hire is frequently well above the cost of ongoing public servants. And this isn't just Labor's view, it's also the view of Scott Morrison'S, the Prime Minister's hand-picked reviewer of the APS, David Thodey. The independent review of the APS, headed by Dr Thodey, delivered its final report in December 2019, explicitly linking declining APS capability, the staffing caps and the increasing reliance on contractors and consultants to perform work that has previously been performed internally. The final review said, and I quote, "Labor contractors and consultants are increasingly being used to perform work that has previously been core in-house capability, such as program management. Over the past 5 years, spending on contractors and consultants increased while spending on APS employee expenses has remained steady." That review unequivocally called for the abolition of the staffing cap and a far more critical approach by the government to the use of non-APS labour to deliver public services, especially the associated costs. Yet the government remains stubbornly committed to its staffing cap policy that is driving poor outcomes. It has also failed to take any meaningful action to quantify the cost of its use of private labour in delivering public services, let alone take any action to contain this rapidly escalating cost. That's despite Finance Minister Simon Birmingham telling the Daily Telegraph, and I quote, "The government has accepted after careful case-by-case assessments, including in some areas of new investments such as aged care and veterans, that is more efficient and effective to use ongoing staff." So my question to the Minister today is, given the Minister for Finance's admission, Mr Thodey's extensive review, along with the evidence from the department and experts, are you persisting with a staffing cap policy that distorts agency decisions and costs Australians more? And Minister, why does the government continue to be willfully blind to the growing costs of consultancy for work that was previously done by the public service?